Hello, Mrs. Smith. My name's Ashley. We're going to be doing we got some physician's orders to do a straight cath today to try to relieve some of that pressure in there, get some of the urine out. If you haven't, I'll give you step-by-step instructions. If you have any questions, just let me know. Do you have any questions now? Okay, perfect. Can you just tell me your name and your date of birth? Okay, and I'm just going to check your wristband here. All right, so we're going to get you into the dorsal recumbent position, and then I'm just going to clean your perineal area. So we'll do that first. I'm just going to pull your sheets back here, and we'll drape them over your bottom half, and then I'll drape your gown over your top half just to provide you with the most privacy we can here. Okay, so then you put the patient in the dorsal recumbent position, and I'm just gonna wash my hands and apply some clean gloves, and I'm gonna get my basin full of water and soap, and just for the purposes of this video, I'm gonna use the same cloth and the same basin, but otherwise at the end when I'd have to just clean up, I would use different cloths in a different basin. So this has soap and warm water in it, and we'll start with doing the farther side away from me, from front to back, and then we'll start with the side closest to me, from front to back, and then right down the middle, from front to back. And then I would take another cloth, and I would just make sure that it's nice and dry, and then we'll put this over here for now and discard my gloves and wash my hands. And then we're going to start with my sterile field. So we're going to open up the package, and we're just going to take the plastic bag that it comes in, and we're going to keep it at the end of the bed just so I can discard anything in there and it's out of the way. Okay, and I'm also going to bring a light over just in case, so if I need to see better in there, then that's there for me. So now I'm going to go ahead and keep a 1-inch margin, just being sure not to contaminate here, and we're going to fold this side out. Being very careful not to contaminate. And then I'm just going to push this whole thing around using the 1-inch margin just so I have some room for my gloves here. Okay, and then I'm just going to get the drape out of here and put it under Mrs. Smith using a 1-inch margin. Putting the shiny side down, and then I'll ask the patient to go ahead and lift their hips, and this is very hard to do, so I believe that this is some contamination here. So if I contaminated, then I would go ahead and start all over again. All right, so now I'm going to open up my sterile gloves. Come over here. Probably need just to push this over a little bit using the 1-inch margin again, being sure not to contaminate, just so I have a little bit more room for my sterile gloves. Open up. The hardest part sometimes is putting these gloves on. So this is now touching the sterile field, this drape, so that could be considered, again, contaminated as well. Okay, so we are just going to discard that, and then I'm going to get this, my hands are sterile, so I'm just going to get this in a nice position. So now I'm going to do the fence-treated drape, and we're going to put this over Mrs. Smith, and I'm going to just make sure that it's cuffed so my gloves don't get contaminated bringing it over. Okay, and then I'm going to make sure that my betadine, my 3 betadine swabs are here, and I'm going to go ahead and open this up, but for the purposes of the video, I'm not actually going to use it, but we're just going to make sure that the betadine is right on the swabs, and then we can just discard that, and then I'm going to just take out anything that I don't need extra in here, and we'll discard all that, and then I'm going to take the lube. I'm going to take the lube and just put a little bit in here, and then we can get rid of that, discard that, and there's one extra thing that we have. And so I'm going to take the tip of the catheter, and we're going to just lube 1 to 2 inches, and then we can go ahead, bring the tray over, being sure just to keep it on the outside here. Okay, so now I'm going to take the labia and just pull up and spread open, and then take the first swab and do the farther side away from me from front to back, and then make sure we're going not over the sterile field, discard that one, and then take the second one, do the closest side to me, don't go over sterile field, discard that. And then there is, we're going to do right down the middle, and we'll discard that. So I'm going to be sure to keep my non-dominant hand on the labia, and if for any reason it slips and goes back over the meatus, then I would consider that meatus, I would consider that contaminated, and then we'd have to start all over. So I'm going to start the procedure now, Mrs. Smith. So I would take the catheter, and we would insert the catheter. We'd insert the catheter 2 to 3 inches, and then if there was, and then again 1 to 2 inches. And if I felt any resistance, then I would just give the catheter a little turn, and I would ask Mrs. Smith to bear down and take 3 slow breaths, and just do that until the discomfort kind of subsides. All right, so we're gonna start. And I would also just make sure that if the catheter, if I insert it into the vagina, then I would just leave it there and start over. And then I would go ahead and if I felt resistance, then I would just go ahead and give it a little turn. So we went the 2 to 3 inches, now we'll go 1 to 2 inches, and then we would just wait for the urine to start flowing, and then once it stopped, then we would just slowly pull the catheter out. And then we would immediately just discard the catheter, and then I would just take the kit and bring it back over here. So sterile field is done now, so we'll bring it back over here, and we'll assess the urine afterwards. And then I'm just going to take all of this stuff and discard this. We'll put this in there, and then I'm just going to go ahead and clean after. So we're going to take a basin with some warm water again and soap, and we'll do the same thing. We're going to just wash the area furthest away, wash the area closest, and wash the area right down the middle. And then we'll dry up here, and we'll put this over here. And Then I would just ensure that put the patient back in a comfortable position. Get rid of this too. And then I would put her back in a comfortable position, and then I would just document how Mrs. Smith tolerated the catheter, if there was any pain, and then also just assess the urine and make sure that the color was okay, the amount, if there was any, like how clear it was, if it was cloudy or not, if there was any odor. And then I would just take off my gloves, wash my hands again, and give the patient their call bell. And then if this was a male, I would retract the foreskin, and I would clean with 3 different swabs. I would clean the meatus and down the shaft, then in a circular motion, then down the shaft 3 times. And then I would lubricate the catheter for the male. You would lubricate the catheter for the male 5 to 7, and then same thing, you would just ask the male patient to bear down as if they were going to void, and then you would insert the catheter. You'd insert the catheter 7 to 9, and then you would go an additional 1 to 2, and same thing, you would document what findings. I know there's something I'm missing with the male. Okay, so I think, okay, so you document the findings, and then and that's it.